Welcome back. In this video, we're going to explore problem-solving therapy exercises, a key technique in cognitive behavioral therapy, CBT, used to help individuals with depression manage challenges in their everyday life. One of the most common situations where problem-solving therapy is applied is when a patient's depression symptoms are worsened by family conflict or interpersonal issues. Today, we'll walk through a step-by-step problem-solving strategy that you can use with patients who are struggling with family conflict and how it impacts their mental health. Let's begin by understanding the situation. Imagine you're working with a 30-year-old patient, John, who is dealing with depression that has worsened due to ongoing conflict with his parents. John feels a constant sense of frustration and helplessness due to his parents' disapproval of his life choices. He feels like he's never good enough for them, and this has led to chronic stress, anxiety, and a deterioration in his mood. The family conflict has made it hard for John to focus on his career, maintain social relationships, or engage in activities he used to enjoy. The first thing we need to do is assess the situation and help John see it through a more structured lens. Step 1. Define the problem. The first step in problem-solving therapy is to clearly define the problem. In John's case, the problem is family conflict, specifically his unresolved issues with his parents. However, the way John feels about this issue, frustrated, guilty, and unappreciated, may make it seem overwhelming and unsolvable. To help John, you would first need to ask clarifying questions to help him identify the specific issues causing the conflict. You might ask, "Can you tell me more about the specific issues you are facing with your parents? What do you think is contributing to the tension between you and your family? How do you feel when you interact with them, and what happens after these interactions?" Step 2. Break the problem down into manageable parts. Once the problem is defined, we need to break it down into smaller, manageable parts. For John, we might find that his family conflict revolves around several issues. Career choice. His parents want him to pursue a more traditional career, but John is passionate about a different path. Communication. John feels that his parents don't listen to his perspective or validate his feelings. Self-worth. John often feels like he's not meeting his parents' expectations, which impacts his self-esteem. By breaking the larger issue of family conflict into these smaller, more specific aspects, we can begin to address each one individually. Step 3. Brainstorm possible solutions. Now that we've broken the problem down into manageable parts, it's time to brainstorm possible solutions for each of these aspects. It's important that John feels like there are multiple pathways he can explore to improve the situation, so he doesn't feel stuck or helpless. For example, for the career choice issue, John could consider having a calm and respectful conversation with his parents, explaining why his career choice is meaningful to him and addressing their concerns. Alternatively, he might compromise by exploring ways to combine his passion with a more practical career option that his parents might be more supportive of. For the communication problem, John could set boundaries with his parents about what types of discussions are healthy and productive. Practice active listening when engaging in conversations to help both sides feel heard and respected. For the self-worth issue, John could work on reframing his thoughts about his parents' expectations. Instead of seeing their disapproval as a reflection of his failure, he might come to understand that their concerns come from a place of love, not judgment. Step 4. Choose the most feasible solution. After brainstorming, it's important to choose the most feasible solution that John feels comfortable with. This solution should be something that John can realistically implement and feel empowered to act on. We don't want him to feel overwhelmed with too many options. For instance, John might decide that his first step is to have an open conversation with his parents about his career choice. He could approach the conversation calmly, using I statements to express how he feels without blaming or accusing. This way, he'll feel empowered to address the issue directly, without avoiding it. Step 5. Create an action plan and set small achievable goals. The next step is to create a clear action plan and break it down into small, achievable steps. For John, this might look like: Step 1. Schedule a time to talk to his parents, giving them a heads up that it will be a serious conversation. Step 2. Write down his main points to ensure he stays focused during the conversation. Step 3. During the conversation, listen actively and try to stay calm, even if his parents react negatively. By setting small, realistic goals, John can avoid feeling overwhelmed and feel like he's making progress with each step. Step 6. Evaluate and adjust. Once John has implemented the solution, it's important to evaluate the outcome. Did the conversation go as planned? How did John feel afterward? Did it lead to a positive shift in his relationship with his parents? Or is there still tension? It's important to reflect on the results and adjust the approach if necessary. For example, if the conversation didn't go well, John might consider approaching the topic differently or seeking family therapy as a way to mediate the conflict. Reflection questions. How do you think breaking down family conflict into smaller parts helps John feel more in control? What are the benefits of setting small, achievable goals when dealing with complex emotional issues like family conflict? How might John's actions influence his self-esteem and overall mental health as he works through the family conflict? In summary, when a patient's depression symptoms are worsened by family conflict, problem-solving therapy provides a structured way to address the issue. By breaking down the problem, brainstorming solutions, and setting achievable goals, individuals like John can regain a sense of control and work toward resolving interpersonal challenges. This approach not only helps reduce depression symptoms, but also fosters empowerment and self-efficacy. In the next video, we'll explore role-playing scenarios where we'll practice diagnosing and recommending treatment for someone with both depression and substance use disorder. Let's keep it going, and I'll see you in the next one.